Hi, my name is Patrice Martin. I come to you today to talk to you about HIV and AIDS contraction in adolescents, meaning young people like yourselves. My specific purpose is to inform you all about the dangers of having unprotected sex and to persuade you all to take preventative actions against the contraction of HIV and AIDS. Many kids and adults are contracting this disease because everyone is sleeping with the same partner and or using the same needles, if any. I come to you today because someone very close to me died of AIDS that was passed on to her through her mother, and when she passed away, she was only 9 years old. That's very young. So that kind of made me wanting to pick the subject and talk about AIDS and find out the prevention of this disease, and not only find out the prevention of it, is to see what I can do to help kids say no to having sex and say no to, doing other things that can lead to sex, because this is not only damaging the person who contracts AIDS, is damaging the whole family, is damaging the community, because the kids are our future. And if the kids are contracting it and the adults are contracting it and they're all sleeping with the same person, I mean, it's the whole world is, just screwed up. Having a boy or girlfriend, like I spoke with some of you earlier today, you said you were, had a boyfriend or a girlfriend and feeling that good moment for the, for that little time, is more harmful than you all think. Just because they say that it's good, or just because they say it's a good thing to do, or it's a cool thing to do, or they won't like you because you don't do it, doesn't mean, it's right. It was written in Preventing HIV/AIDS and Adolescence by Ashorn J.E. Rogers that during the past years, the National Commission of AIDS was conducting public hearings trying to foster a greater understanding of the challenges facing the nation as it confronts the AIDS and HIV epidemic. Another way that is indirect evidence is that drugs are closely associated with the raising rates of sexually transmitted diseases, where especially high for teens like yourself who both sold drugs and combine sexual acts within the drug taking. And this was taken from the African American Youth and AIDS High Risk Behavior by Benjamin Bowser and Mindy and Robert Fullilove. Many teens I spoke with before this meeting, before this speech, they say that they use drugs because they are hooked. And many of them use sex to support their drug habits. We have to open up our eyes and make positive choices so we won't be one of those statistics, in the number of the HIV and AIDS contraction. With young people like yourselves, you are increasingly at risk for HIV. Although infection rates in other populations have risen and falling over the years, adolescents continue to become infected in growing numbers. And this was taken from Variation in Health and Risk Behavior Among the Youth Living with HIV/AIDS by Rawthorne, Boram, And also, I read upon the challenge of HIV prevention among high-risk adolescents by Sullivan T. Orr. According to this, there was a study conducted concerning sexual orientation where gay and bisexual men were similarly overrepresented among HIV/AIDS infected youth, consisting it was like 64% of AIDS cases reported between July 1993 and June 1994. Among these, the kids were below the age of 25. That's really young. That's most of y'all age in here. So don't think you can't get HIV because you are not gay, or you don't mess with boys, or you are not around people that have AIDS, or you are a clean person, because everyone is subject to contraction, because only if you are not protecting yourself, and only if you're not doing the things that you're supposed to do, and you're putting yourself in the predicaments to do so. I want you all to make positive choices in life and be a leader and not a follower, and to strive on and prevent the epidemic to keep going and contracting our youth with AIDS. Remember this motto: an ounce of prevention is worth a pound of cure. Remember that. An ounce of prevention is worth a pound of cure. Thank you all for listening, and you have a blessed day.